registered physiotherapist. Today I'd like to talk about two really popular injuries recently in terms of a full ACL tear and a full Achilles tendon rupture. So these essentially are the injuries that took place during the NBA playoffs this year with Kevin Durant in terms of a complete rupture of the Achilles tendon, and then Klay Thompson with the full ACL tear. And I'll talk also just a little bit about the rehab and recovery time for these. So first with Kevin Durant, so essentially what happened with him, he had a full tear of his Achilles tendon, which is the tendon on the back of the heel essentially, which connects your gastroc or your calf muscle to your calcaneus, which is essentially your heel bone. This injury tends to take place when somebody is pushing off and has that gastroc muscle in a lengthened position with a quick contraction. So you see this quite a bit in obviously basketball, tennis. You see it in jumping sports, where again that Achilles tendon is in a stretched position and there's a quick contraction that takes place at the same time. Now, in terms of recovery, rehab with this particular injury, things have changed a little bit in the last 5 to 10 years in terms of how you rehab this. So previously I would see lots of patients coming in who have had surgeries for these, in which they would basically the two ends of the Achilles where the tear takes place, they would put those two ends together and essentially suture that up, and then the client would be in a boot for typically a number of weeks, usually 6 to 8 weeks in a boot. Nowadays I see a lot more in terms of doctors deciding not to actually do surgery and to just have the patient in a boot in which their toe, they're going to be in more of a plantar flexed position, so to speak. So by placing your foot in this position over a prolonged period of time, the goal essentially is for those two fibers to join up and to scar down into this position, and then to actually rehab from there. Now, your typical rehab period can go anywhere from 6 to 9 months typically, and then from there, that return to sport, you're usually looking at around a 9 months to 1 year period. So you can understand why Kevin Durant's going to be again out for the full year based on what's required in terms of his specific sport. And so in terms of the rehab with this, again, there'd be a prolonged period of time in the boot. Usually what we would do from a physio standpoint is work around the area of injury. So for example, glute strengthening, core strength, quads, hamstrings. So basically all of the different muscle groups around that area that we can work on maintaining, keeping strong. And really the key during that sort of period of time is to avoid atrophy, right? Avoid weaknesses in those muscles. Once that scarring has taken place, there's going to be a period of time in which you're going to do some scar tissue maintenance in terms of breaking down the scar tissue. Things like therapeutic ultrasound can be beneficial during those periods of time. And then super gentle, non-weight bearing movement of the ankle, not going typically beyond that neutral position in terms of bringing the foot up. The reason for that is you want to obviously be super careful in creating another tear in the Achilles, particularly when it's scarred down. And then again, as time goes on, weight restrictions, getting out of the boot, you'll be working on tons and tons of gastroc soleus strengthening, then doing things such as weight-bearing specific exercises, eventually having the client doing weight-bearing heel raises. That's going to completely activate the gastroc, then making it sports specific. So again, this is a long-term rehab process for especially for somebody who's got a physical lifestyle. Obviously, Kevin Durant being a basketball player, it's going to take a significant amount of time to get back to that level of functioning. So again, that's why he's going to be out for a year, unfortunately. The next injury, that full ACL tear, That's the injury that was sustained by Klay Thompson. Essentially, what occurs there, your ACL is called your anterior cruciate ligament. It's responsible for stabilizing the knee in an extended position. So if you think about this area, my arm here being essentially your tibia, the bottom portion of your leg, my femur up here, what the ACL does is it prevents extension forward in this position. So in terms of what occurred when he had his injury there, essentially the tibia, or the leg, when he planted, it was completely stable, and unfortunately his body, you can see on the instant replay, it went fully forward, and that's when the ACL would have been ruptured. Now typically with ACLs now, in terms of rehab, it really depends on how the injury occurred, or how much of the ACL sort of remains in terms of what the surgeon will use as a substitute for the ACL. So sometimes they'll actually take from the hamstring tendon to use as a substitute for the ACL when they're actually doing the surgery, or a graft of some type. So once the surgery takes place, then the patient typically would be in it's called a Zimmer splint. A Zimmer splint, it will prevent bending and extending in the leg. Also, there'd be a period of time typically of being non-weight bearing using crutches. And then from there, rehab starts fairly early in terms of after an ACL. So typically, you want to get the knee moving fairly early after the surgery. The reason for that is the knee obviously will be quite swollen, and so we want to get some movement going. Things you really have to avoid with an ACL is, particularly early on, is making sure that you're not allowing the knee to go past the toes when we're doing, for example, a sit-to-stand of some type. And also any sort of open chain is called leg extensions. Again, that's going to stress the surgical site. So again, there's a fairly long period of time in which the patient will be in a Zimmer splint. Usually it's around a 4 to 6 week period of time. During that time, we want to work on strengthening the muscles that essentially surround the knee joint. So the quads, hamstrings. We want to do some passive and active range of motion exercises, not going into pain. After that 6 week mark, typically patients will then be on a bike of some type, stationary bike, again to improve mobility, help with swelling. From there, it's a period of time in which you start doing some weight bearing specific exercises, balancing, squats, again being cautious of any sort of specific restrictions that might overstress the surgical site. Running typically doesn't take place until around the 9-month to 1 year mark. So that's one of the main reasons in terms of from a time frame with rehabbing that, again, Klay Thompson's going to miss a whole year of basketball, is that running action. It obviously there's that extension component in a weight bearing position, which is going to stress that ACL joint, or that ACL ligament. And so it takes a significant amount of time in terms of strengthening the muscles that surround the knee before you can actually incorporate running, directional changes, plant, twisting. So again, unfortunately, the rehab for a ACL complete tear after surgery tends to take between that 9 to 12 month period of time. And so again, it's unfortunate that both these injuries have taken place to these sort of superstars of basketball, so to speak. So if you have any questions, concerns for me, please feel free to leave a message below. And thanks again for watching. Take care.